I'm Andrea Baldeck. I'm a physician with an arts background, and my book is called Bones, Books, and Bell Jars, Photographs of the Mütter Museum Collection. I was allowed to adventure into the storage areas there and to witness the amazing trove of books, specimens, bones, instruments, you name it, that is not generally on view to the public. Down in one of the many rooms in the basement warren are amazing collections of instruments. These strange instruments that are layered one over the other include a set of placental scissors. And then this very strange backwards looking instrument was actually a uterine dilator. And I'm glad to say that neither of these is used in current practice. A fellow named Albinus, Siegfried Albinus, in 1747. He had an artist who worked very closely with him. The artist sketched as he did the dissections, and in the background there is this little sort of spirit with wings, this puto almost. If we had been living at the time and knew our mythology and allegory, we would recognize that this is an allegory of time revealing the truth. And so this little puto is revealing the fact that we are all eventually going to end up as skeletons, that life is transient. In the collection are some remarkable specimens, including this one, which is called an anencephalic dwarf. This fetus, it was a full-term delivery, but his brain never developed. Part of the defect is that the skull never closed over the brain. So this child would have been dead at birth or shortly thereafter. Most of the fetal specimens in this collection date from far before we had the capacity to look inside the womb. We take for granted so much the imaging techniques that are available to us, X-ray, MRI, CAT scan, ultrasound, that we forget what it was like when a physician had a pregnant patient and could tell only from outward appearance of the mother how the pregnancy was progressing. I mean, imagine a woman being in labor with these conjoined twins, and how eventually there must have been an emergency cesarean section, because there's no way you can deliver these vaginally. And it would have been probably at the end of a very tortuous, prolonged labor, and then to finally remove these conjoined twins from the womb and have them essentially, not be able to survive because their organs did not permit sustained life outside of the womb is pretty horrific for both patient and physician. I love the very abstract shapes. In the center we have the three different sizes of what were mouth gags, so that the physician could put the extended tongue-shaped part of it against the tongue of the patient and have them clamp their teeth down around the ring, and that way essentially create a channel to look through without the patient closing the mouth. And in addition, these strange parts are finger protectors, so that if a physician or dentist had to probe inside the mouth of a patient, they wouldn't risk being bitten. In the collection of the museum, there are these remarkable sculptures made of beeswax that were very popular in the late 18th and through the 19th century. These were used to teach anatomy and diseases of the skin. I found it most interesting photographing this in black and white, because the grayscale of film, which I use, allows for these very subtle gradations of light and shade, both across the face, but then also incorporates some of the reflections from the jar that encloses it. And with the very black background that seems to just sort of suck in all the light, this disembodied head is floating around in the picture and is quite unearthly. This is a book that I recognized might give some people trouble. I wanted to convey what it felt like to have a conversation with history and to appreciate the patients and physicians who had gone before. So this is a little bit of where we've been and a great homage to those who were the trailblazers, along with a sigh of relief that we don't have to expect quite this sort of treatment milieu when we are in need of medical assistance.